everyone, this is Pathak and you're watching my channel. I'm back again with another video. So this time I'll talk about chapter number 9 of NABH Science 5th edition, which is Human Resource Management. You can also see the Instagram ID on the slide, which is Healthcare for You Forever. You can follow my account, and let's get started with this particular presentation. Okay, now I'll talk about the intent of the chapter. So the first point here on the slide is the most important resource of the organization is its human resource. Human resources are an asset for effective and efficient functioning of the organization. The management plans on identifying the right number and skill mix of staff required to render safe care to the patient. So in this particular point, it is written that an organization requires right number and skill mix of staff to render safe care to the patients. That means there should be right number of doctors, nurses, paramedical staff to provide care to the patients. Then the second point here on the slide is the recruitment of the staff is accomplished by having a uniform and standardized system. The organization must orient the staff to its environment and also orient them to specific duties and responsibilities related to their position. The organization should plan to have an ongoing professional training in service education to enhance the competencies and skills of the staff continually. So this is really very important. The orientation and the training of the staff is really very important so that everyone in the organization delivers their services in a proper manner. So this is an important point. Now let's move on to the next slide to talk about the rest of the points of the intent of the chapter. Okay, so now I'll talk about the second slide of the intent of the chapter. The first point here on the slide is the systematic and structured appraisal system must be used for staff development. The organization uses this as an opportunity to discuss, motivate, and identify gaps in the performance of the staff. So basically this appraisal system is for analyzing the performance of the staff. That is really very important so that this appraisal system can identify the gaps and motivate the staff to improve themselves. The organization promotes the physical and mental well-being of the staff. A grievance handling mechanism and disciplinary procedure should be in place. Okay, so if someone has a problem or someone has a grievance, then they can put in the grievance and then this grievance can be resolved. Okay, so this is really very important. Then the last one here on the slide is the credentialing and privileging of healthcare professionals are done to ensure patient safety. Okay, so it is done for medical, nursing and paramedical staff, paraclinical staff. So this is also really very important because without credentialing and privileging, no healthcare professional should be employed in the organization. So this is the intent of the chapter. Okay, so we will now move on to the next intent of the chapter. Okay, so now we will talk about the rest of the points of the intent of the chapter. So the last point here on the slide is the document containing all such personal information has to be maintained for all staff. So there should be a document, there should be a file which contains all the personal information about the staff, their certificates, their address, their blood group, their parents' name, their age, their qualifications, okay, and their credentials. Everything should be stored in that file. Okay, so that is really very important. Now the note here on the slide is really very important again. So the term employee refers to all salaried personnel working in the organization. The term staff refers to all personnel working in the organization, includes employees, fee for service, medical professional, part-time workers, contractual personnel and volunteers. Credentialing, privileging of healthcare professionals, medical, nursing and other paraclinical professionals are done to ensure patient safety. Okay, so now we will move on to the next slide, which will talk about the standards of this particular chapter. Okay, so now I'll talk about the first standard of this particular chapter. So the first standard here on the slide is the organization has a documented system of human resource planning. So human resource planning is really very important because you need to understand what kind of people are required in the healthcare organization. You need to know how much salary needs to be given to each and every person who is there in the organization. So this is an important standard. Okay, and it involves various things like that job specification, job description. Then it also includes the future ability to meet the care, treatment and service needs of the patient. Okay, then it also involves adequate number and mix of the staff to meet the care, treatment, service needs of the patient. So these are all the things which are involved in the human resource planning. Now the second standard on the slide is the organization implements a defined process for the staff recruitment. Okay, so there's a written guidance for the staff recruitment as to how to recruit the staff, what are the steps to recruit the staff. Okay, then a pre-employment medical examination is conducted for the staff. The organization defines and implements a code of conduct for its staff. Then administrative procedures for human resource management are also documented. Now the third standard on this slide is the staff are providing induction training at the time of joining of the organization. So induction training is like an overview is given of the organization, that what are the mission, vision, values of the organization. Then they are given an overall view of the organization. Then induction training also involves training on safety. Okay, then it includes orientation to the organization vision and values that I have already told you. Then it includes awareness on the staff rights and responsibilities. Okay, includes orientation to service standards of the organization. Hospital infection prevention and control training is also given in this particular thing. Then there's an ongoing staff program for the professional training and development of the staff. This is the fourth standard, and this basically involves that there's a written guidance for the complete training and development of the staff. The organization maintains a training record as to who has attended the training and who has not attended the training. Then it also includes the job responsibility change and new equipment is introduced. The training is given on that particular aspect as well. Okay, then evaluation of training effectiveness is also done by the organization. So this is all involved in the fourth standard. The fifth standard on the slide is the staff are appropriately trained based on their specific job description. Okay, so everyone has their own job description, like it is different for nurses, it is different for doctors, it is different for paraclinical staff. Okay, so staff involved in blood transfusion services are trained in the handling of the blood and blood products. Staff are trained in handling vulnerable patients. Staff are trained in control and restraint techniques. Staff are trained in healthcare and communication techniques. So this is involved in the fifth standard. So let's move on to the next slide to talk about the rest of the standards of the chapter. Okay, so now I'll talk about the sixth standard here on the slide. The sixth standard is the staff are trained in the safety and quality related aspects. This basically means that staff are trained in the organization safety program. Then staff members are made aware of the procedures to follow in the event of an incident. Staff are trained in the occupational safety aspects. Staff are trained in the organization disaster management plan. Okay, so this is all including the sixth standard. Seventh standard here on the slide is an appraisal system for evaluating the performance of the staff exists as an integral part of the human resource management process. Okay, so this basically means the staff are made aware of the system of the appraisal at the time of induction. Performance appraisal is done for the staff within the organization. The performance is evaluated based on the predetermined criteria. Appraisal system is used as a tool for further development. So this is all included in the seventh standard. The eighth standard here on the slide is the process for disciplinary and grievance handling is defined and implemented in the organization. The disciplinary and grievance handling mechanism is known to all categories of the staff of the organization. A written guidance governs the disciplinary and grievance handling mechanism. The disciplinary policy and procedure are based on the principles of natural justice. There is a provision for appeals in all disciplinary cases. Actions are taken to redress the grievance. So this was all about the 8th standard. Now we will talk about the 9th standard, which is the organization promotes staff well-being and addresses their health and safety needs. Staff well-being is promoted. Health problems of the staff, including occupational health hazards, are taken care of in the accordance within the organization policy. Organization provides treatments to the staff who sustain workplace-related injuries. Health checks of staff dealing with direct patient care are done at least once a year, and the findings and results are documented. So this was all about the 9th standard. 10th standard here on the slide is there's a documented personal information for each staff member. So this basically all includes the records of in-service training and education are contained in the personal files. Personal files contain result of all the evaluation and remarks. The personal file contains the personal information regarding staff's qualification, job description, verification of credentials and health status. The personal files are maintained with respect to all staff and their confidentiality is ensured. So this is all included in this 10th standard. So let's move on to the next slide to talk about the rest of the standards of this particular chapter. Okay, so now I'll talk about the 11th standard. The 11th standard here on the slide, there is a process for credentialing and privileging of medical professionals permitted to provide patient care without supervision. So it includes that the education, registration, training, and experience of the identified medical professionals are documented and updated periodically. The information about medical professionals is appropriately verified when possible. Medical professionals are granted privileges to admit and care for the patients in consonance with their qualification, training, experience, and registration. The same thing goes for the 12th standard and the 13th standard. The only difference is that the second standard states that the credentialing and privileging of the nursing professionals is done, and in the 13th standard it is written that the credentialing and privileging of paraclinical professionals is done. The same goes for the 12th and the 13th standard as well. Okay, that the nursing professionals education, registration, training, experience of the identified are documented and updated periodically. The information about them is appropriately verified when possible. Okay, so this is all included in the 12th 13th standard as well. Okay, I hope you really like this video. Okay, so please do not forget to like, share, subscribe. Thank you for watching my video. I hope you really like this video. Please don't forget to like, share, subscribe my channel. I would be really very grateful. Till then, I will meet you in the next video, which will talk about the last chapter of NABH Science 5th edition, which is the chapter number 10, Information Management System. So till then, stay tuned. Bye bye.